Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in adult transgender care. Welcome to my channel. If this is your first time here, or if you are a regular viewer that has not had a chance yet to subscribe to the channel, I would very much appreciate if you do. This way you will be helping me and so many other people find this content. If you also don't yet follow me on Instagram, link is below. Make sure you follow me on Instagram. That's where I show up additionally to share tips, guidance, support, information, and a whole bunch of great other things. So let's all stay connected. For today's video, I would like to share my professional opinion, share my insights on three of the most nagging questions that older trans women tend to repeatedly ask me again and again and again and again. Some of these questions I'm actually surprised that I have to give answer to today, but if I keep being asked the same question again and again and again, that's only an indication to me is that this information still needs to be put out there. And I think it's really, really important for people to have clarity. These are the questions that I get people emailing me about, people reaching out and direct messaging me on Instagram about. These are the questions that I get my personal clients ask me. When I consult with you in my, that I offer the 15-minute complimentary consultation, a lot of people reach out just to ask one, if not all of these three questions. And it's really important to talk about them because I feel that even to this day, there is a lot of misinformation out there. So without further ado, let's jump into first question. The first question that I get repeatedly asked about is whether the person who is asking is wondering if they are too old to transition. Now, every time people ask me if they're too old to transition, I always wonder too old in what regards, right? A lot of times people think they're too old to transition because they are not in a good enough health to be able to step in the medical hormonal part of gender transition. A lot of times people ask me this because they feel that they're at a point in a life where nothing is going to help them to pass if passing is their priority, their goal. So if you're watching this and you're asking yourself if you're too old to transition, my advice would be, first and foremost, first of all, let me just say this. You're never, ever, 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 ever too old. And I'm going to say this repeatedly on all of my content, on all of my social media. A person is never too old to transition. I say this because you need to realize gender transition is very broad. It's not just medical hormones and it's not just surgical. Gender transition encompasses social aspects of coming out, embracing your femininity. It encompasses your presentation. It can encompass legal parts where you actually change the documents. It also encompasses spiritual internal connection and alignment and integration within yourself. It encompasses, it goes on and on. Gender transition is very broad. So when you say, am I too old for which part exactly? Now, what I often tell people is that depending on your age and the older you are, you may be in a position where certain parts of gender transition are going to be limited to you, are going to be off limits to you. For example, if you're older and again, this is not for everybody. It's a lot of people who are older are in fantastic health. And then there's a lot of times age does affect our health. Other factors as we age affects us. And so you may be in a position where because of other conditions you're struggling with, health conditions you're struggling with, your doctor may say that hormones are not an option for you. Perhaps going through a long surgery may not be an option for you. Perhaps some surgical things are going to be off the table for you. And this goes to say not just for limitations that are byproduct of any kind of health concerns. You may have limitations to you as an older person for a lot of other reasons. Now, certain elements of transition may be not accessible to you because of the finances, lack of access of resources, where you currently live and reside, potentially safety issues. It's going to differ for everybody. You're definitely never ever too old, and there is no limitations to acknowledging to yourself who you are, to accepting to yourself who you are. You're definitely never too old, and there's never a limitation to start opening up that part of yourself to somebody. If you don't feel like you can open it up to people around you, to your loved ones, can you open up to it to me? Can you comment below today and express that you are a trans person? There's so many things about gender transition that are not limited to age. Starting to express yourself, starting to bring more feminine attributes into your life, starting to embody the feminine more is limitless. Limitless. Everybody who is watching right now, I want you to, in a comment, just drop your age, the age when you started to go through transition. Just drop the age, just put the number down. This will be so helpful for anybody who is hesitating because they're too old. I recently on my Instagram put a post that you're never too old to transition, and the number of incredibly supportive and positive comments is it's beautiful. If you're struggling with this, wondering if you're too old, just go look at that post. Just go look at the comments under that post. So many people openly shared that they have suffered with gender dysphoria for X amount of years and only started their transition in their 50s, 60s, even 70s. So many people shared that they started earlier but then stumbled, stopped, and started again later. The accounts are numerous, and the accounts are so deeply personable, and it just goes to show you that it's never too late. So if you're wondering if it's ever too late to start gender transition, the answer is no. Now, sorry, let me just quit my email here. Now, there are individuals out there who are wondering, well, maybe it's too late for me because I have built out what I usually call your world ecosystem, right? Things you do for a living, you have family, you have kids, you've been with your partner maybe for X amount of years. And so you think it's too late for you because if you were to own up to who you are, you're going to disrupt the system. And again, the answer is it's not too late. Your fears are just your fears. But in reality, your circumstances are not limiting you to owning up your life and being who you are. You are limiting yourself because you are afraid, or you're limiting yourself because you don't want to deal with how things might settle down. But it's never, ever, ever too late. And remember, gender transition is broad. There's so much you can do. So that's the first question that people ask me, is whether they're too old to go through transition. And I don't know where this idea starts from. It's not as if we have a whole bunch of youngsters who are going through gender transition. The second most common question that people ask me, and this I know comes from Reddit, comes from Facebook, comes from pretty much internet, and comes from people who, in my opinion, are not really having a full grasp and a full understanding of what they're talking about. Remember, just because somebody has gone or going through gender transition or is transgender does not make them an expert on gender dysphoria. It may make them an expert on their life and what that has been for them, but it doesn't make them an expert in everybody else's life. So the second question is this. People wonder whether they can identify, embody, and embrace their woman identity without the need for hormones or surgery. This is directly, again, comes from people out there spreading, in my opinion, harmful information, harmful lies, exclusionary information that goes something along the lines of, and all of you know what I'm talking about. You're not a woman, you're not a trans woman unless you are on hormones. And if that wasn't enough, you're not a trans woman unless you also have surgeries. And oftentimes, most importantly, you have got to have genital surgery. Otherwise, you're not a trans woman. You cannot own a woman identity, you cannot embody a woman's identity unless you're going through medical and surgical part of gender transition. And people often even say that, I'm trying to phrase it in a nice way, because I'm really so tired of this. Because first of all it does is medicalizes gender identity. Second of all, it reduces gender transition to just surgical and medical. Gender transition is not just surgical and medical. Surgical and medical, I don't know how to say that enough, is a part of gender transition, a part among other parts. You have to figure out for yourself which parts of gender transition not only do you need, not only do you want, and not only are accessible and actually are realistically within the scope of your reach, the scope of you being able to accomplish it. This is how a person figures out which elements of gender transition to take. This is why so many trans women are out there not getting all gender affirming surgeries. Because one, they may not afford it. Two, they can't have it for medical reasons or otherwise. Three, they don't want it. There's no reason to go and modify otherwise healthy body and body parts unless it gives you distress. So to say that you're not a woman unless you go through medical surgical is basically saying that everybody out there who did already go through medical surgical were not women before they started transition. So what does it mean? The woman's identity starts with medical surgical? Just think about how silly that is. It is absolutely silly. So this information is, in my opinion, very harmful because it holds people perpetually in a cycle of not enoughness. Now, medical and surgical are great options again. They're great treatment options for people who want, need them, can have them. They're great, and a lot of times, especially for safety reasons, they are a necessity. In today's society, let's be honest with ourselves, in today's society, those things are necessary in order to have external gender markers of what a woman is, right? That's just the reality. But there's a difference between embodying and owning your woman identity and then externalizing it by aligning yourself closer with those external factors by going through medical or surgical interventions. If you are identifying as a woman, you identify as a woman. And no amount of body surgeries are going to somehow change that. Now, gender affirming surgeries can make you feel more confident, more aligned, alleviate dysphoria if you have dysphoria toward those body parts. It can give you closer or bring you completion to passing if passing is your goal. But your identity is not defined by hormones. It's not defined by surgeries. Let me say that again. Your identity is not defined by hormones. It's not defined by surgeries. And I'm going to do a whole video about medicalizing gender identity because I'm so sick of hearing it. So if you are a trans woman and you think that you have to do all of this in order to identify as a woman, you don't. You absolutely don't. You need to do what's important to you. The mistake I see people make, and I need to talk about this more too. I have clients, not many, I have actually a recent client who expressed this to me and it broke my heart. It broke my heart, people. It's a client I've been working with. She's in her late 30s and she has had gender affirming surgeries and on hormones, and her goal was to pass, and she looks wonderful and she passes. And she told me, she said, Dr. Z, I achieved everything I set out to achieve. And I am happy, don't get me wrong. I don't want to go back. I'm very happy and I don't regret anything. But I realized that I was part of what I achieved is not who I am. I look at myself and this is not exactly how I see myself. A lot of it is, but a lot of things are, I just thought that's how I was supposed to be, or that's what I was supposed to do. And that's just, it's almost like you spent years and years living with dysphoria, right? And pretending to be the man, in her case, in a lot of your cases, because you were assigned man at birth, pretending to be the man that she was not meant to be and never going to be, no matter what she does. Only then goes through such big life-changing gender transition event. And because sadly, she never really set out to establish her own personal standards of what she needs, what she wants, who is she? She was so busy fitting into the mold and in the boxes that now she's realizing she's this idea, this expression of a woman that not exactly also her. So it's really important to figure out what's essential to you. Who are you? Anybody out there who tells you you're not a woman because already doesn't know what they're talking about. Trust me. Anybody who says you need medical surgical to identify as a woman, is all they're doing is they're creating barriers and they're policing and they're creating other forms of gatekeeping and exclusions. And it's not all right. So this is the second thing that I get asked a lot is, do I need to go through medical and surgical? Absolutely not. No, you don't. Figure out what you need. And the reality is a lot of you maybe can't even go through medical and surgical for a lot of personal reasons. The third one that people ask me, and this is really important one, and I want you all to pay attention to this, because this is, again, maybe even I on my channel don't talk about it enough, and I need to, is people ask me a lot whether they can start hormones to either take the dysphoria down a notch, to feel better psychologically, and most importantly, whether they can start hormones just so they can feel more like themselves, so they can feel more aligned with the woman that they are, without socially presenting as women. Can they do that? The answer is 1000% yes. Yes, you can. You absolutely can. A lot of people, I work with older adults, who after some discussion and exploration have come to personal conclusion that socially presenting and socially transitioning is not something they're interested to do at this point of their life. And they have a lot of their own personal valid reasons. For some, the dysphoria is not distressing enough. For some, they're not ready to deal with what ripple waves that might set out. For others, they just don't feel like it's worth it. For a lot of other adults I work with, what happened is that because they've been living with gender dysphoria for so long, their internal sense of identity continues to be very fixed. So a woman is a woman is a woman is a woman is a woman, no matter how long she's been living, and not presenting as a woman, meaning not being out yet, right? But depending on how she coped throughout this whole time, what I see in a lot of adults is that they develop internal stable identity of a woman, but external, more fluid way of navigating this gender. So a lot of adults I work with get to the point in their life where they say, I no longer need, nor have a strong need and desire and want to be socially seen externally and accepted as a woman by anybody. I have accepted it myself over the years, and I also have established a more fluid relationship between polarities of my woman identity within and my external male presentation externally. And I'm okay with that. So again, internally stable, strong, fixed woman identity, but externally the person is also more fluid and more comfortable navigating the world as a man. So there's a lot of reasons why people may decide to do hormones, and I have lots of clients who do hormones for, again, psychological well-being, to feel more connected to their woman side, to affirm things for themselves, all without stepping into social presentation. Okay, so keep that in mind, very important. Hormones are not just, we're going to give you hormones only and only if you then agree to fully continue your gender transition and then fully socially live and present. No. All parts of gender transition that I described early in the beginning of this video, the broad strokes of gender transition, are there to help you. And it's meant to be broad because you're meant to pick and choose what works best for you, because everybody's different, everybody's needs different. Most importantly, everybody's gender dysphoric distress is different. If you have no gender dysphoria toward your genitals, and on top of that you feel comfortable with your genitals, one has to ask, why go through vaginoplasty? What is it going to give you? What is the benefit in this case, right? And if the benefit is it's just going to make me overall feel more congruent, okay, that's valid. But what if for a lot of people there is no benefit? What if a lot of people say, I'm totally fine. My genitals are mine. I'm the only one who gets to see it. Maybe my partner. To me, surgery is not worth it at this time. That in any way invalidates their womanness? Of course not. This whole idea on the internet, and this whole idea especially in transgender circles, about, trans woman is this, and not this, is also, without realizing, people don't realize, not only do they over-medicalize the trans womanhood, but they also overly merge it with the binaries, to the extent, binary is not the right word, but they're over merging it and disregarding transgender history and transgender individuality. So these are the three most pressing things I get asked constantly. I bet after this video people will continue to ask me this, because again, there's lots of stuff out there that is just plainly not true. So remember, it's never, ever, ever, you're never too old to step into any or all elements of gender transition. There might be limitations to what you can do, but those are only limitations. You don't need to go through medical or surgical in order to identify as a woman. Your gender identity as a woman is not defined by surgeries, and it's not defined by hormones. Trust me, it's not. And 3, you absolutely can do feminizing hormones only to alleviate psychological distress or to feel more connected to your womanness, or whatever other personal reasonings you have, without socially presenting as a woman. Okay? Very important. If you disagree with me, constructively comment below. I would love to know which parts and why. A lot of times I seldom see any disagreement. I usually, if anything, people feel like they can breathe. Somebody vocalize this, right? Because there's just so much, again, barriers that are put down, and especially by trans communities themselves. And it kills me to see it. Comment below, let me know which one of these three you struggled with, or maybe all of these three. Do you still struggle with any of them? Comment and share your age when you started gender transition. Comment and share if you are on hormones and not socially presenting. How does it benefit you? I bet it does. Comment below if you identifying as a woman without gender affirming surgeries or even hormones. And how does it make you feel? I bet it makes you feel more connected to yourself, because it should. Comment below. Let me know what your thoughts are, and I will see you all next time. Goodbye.